Well, good afternoon. Today is Sunday, May 3rd, and my name's Rich, and this is my cancer journey. Um, Specifically, I've got colorectal cancer and it's signet ring cell carcinoma. The goal of these videos that I'm putting out is hopefully somebody can find some useful information that they can relate to their journey uh, that they've got. I'll try to mix these videos up as time goes on. I'm just learning the whole YouTube thing, so we'll try to up the production quality as we go along. In any event, a little short review. This is episode 2, and the review from last video covered various symptoms leading up to my cancer diagnosis, and that brought us all the way through 2024 and into January 2025 when I had a colonoscopy and was diagnosed with colorectal cancer, signet ring cell carcinoma, stage 3C, and it was synchronous, which means I've got 2 tumors, one on each side, the left side and the right side. So I kind of, you know, uh, got kind of a double whammy there. In any event, that was in late January of 2025. I had my colonoscopy, and at that time, it was decided that we'd spoken to, or my doctor had spoken to our uh, local hospital, and it was decided that I should get more advanced care at Denver. So we made the drive to Denver and checked into the ER at UC Anschutz Medical Center, which is a very large medical center. It's like a city unto itself. Um, but I got through the ER and checked into a room in surgical oncology within a couple hours. So that was good. Those the synchronous tumors that I mentioned earlier had impinged on my ureters for my kidneys. So my kidneys weren't draining properly, and that's called hydronephrosis. And so that was the immediate concern, was we didn't want to damage my kidneys. And so they decided they'd put stents in my ureters, which would allow them to drain. And if they weren't able to do that, they'd have to do what they call nephrostomy tubes, which what those do is they drain out your back and into a bag. So I was rather shocked about that prospect, but nevertheless, we went ahead and had that looked at. So in the end, they weren't able to stent my left ureter, so I got a left nephrostomy tube put in, and my right one was a stent. So we went ahead with that, and so I ended up having basically my kidneys are now draining into bags, uh, and that, like I said, that was the idea, was that um, that would take care of the immediate problem. If you'll recall from my last video, I had back pain, and that was largely the cause of that. Um, let's see here. So over the course of my stay at Anschutz, which was about 5 days, we scheduled a time and some MRIs on the cancer, and we decided to stay in Denver to meet with the MDC, the Multidisciplinary Committee. And what that is that's a group of oncologists, in my case, surgical oncologists, urologists, and gastrointestinal, to decide what the best course of action would be for my cancer. Um, Frequently, a lot of people get surgery right away. It was decided in this case that the surgery would be postponed because of the size and location of the tumors. They hope to do chemotherapy and radiation, shrink the tumors, and then eventually restage in fall of 25, and then have surgery either late 25 or early 26 um, to remove the tumors, and then I'd continue um, chemo to clean up the balance. but they wanted to save as much as possible. So that's what the decision was, and that meeting was on February 5th. Um, so the chemo that I was prescribed was a regimen of 8 rounds of Folfox um, chemotherapy, um, and that is a chemotherapy that is a pretty standard regimen for colorectal cancer. The challenge is with signet ring cell carcinoma, it's highly resistant to chemotherapy, and so we were hoping for the best. But that signet ring cell carcinoma is kind of a tough one to battle. It's pretty aggressive. Luckily, signet ring cell carcinoma is only 1% of colon cancer patients, and then to have it synchronous, to have two tumors, is 4% of the 1%. So pretty rare that would um, that you'd ever get that, but that's the hand I drew. Um, so we set up a schedule for chemo. During this time, I did get a UTI and ended up in the hospital, and with a fever of 102. I also had a port placed at this time. I'm kind of breezing through this area. A port is a device in your chest that allows them to administer chemo without doing IV, so a lot less poking and stuff. And that procedure only lasted like 20 minutes, and that was fine. The infection that I had that ended up in the ER was a UTI, and they got me out of there in a few days there with some antibiotics and things, and I was back going. But also, what they found was that right stent was causing some issues. So, with that right stent causing issues and infections and things, is at least what they considered. It really was failing, and so I went back to Anschutz, and they um, took the stent out, and then ended up putting another nephrostomy tube. So I had both right and left nephrostomy tubes. So I've got saddlebags basically. And, I joke around about it that you can drive across the country now without stopping for a potty break. But anyway, um, the that was took some getting used to, but it was fairly straightforward. You learn the procedures, and in a future video, I may go over some of these specific things, such as the care of nephrostomy tubes and things like that. Um, so on February 25th, I had my first round of chemo, Folfox, and I scheduled, as I mentioned, scheduled for 8 rounds. The oncology team is just outstanding there, really, really good. And basically, I'd have chemo every 2 weeks. So they'd administer chemo for about 4 or 5 hours. I forget exactly the time of those first rounds. And then I would get a pump that would administer chemo at a lower rate for a couple of days. So if I had chemo on a Monday, the pump would be with me overnight and a couple nights, and I would end up going back on the following Wednesday, in that case, Monday to Wednesday, where I'd have the pump removed. The pump goes in through the port as well in your chest, and then I'd be off for about 10 days before the next Monday um, would come up. So it'd be about a 2-week cycle like that. During that time, a lot of times they'd give me uh, steroids, and that would tend to keep me up at night. Still do. I've kind of cut back on the steroids a little bit there to help with nausea. The chemo tends to wear you out a bit, but in some people they get pretty bad nausea. But in my case, my nausea was very moderate, so I have cut back on the steroids. But it still tends to keep me up in the middle of the night a number of times. One of the groups I contacted during this time was a group called Man Up to Cancer. They're a group where men can vent about their cancer journey, and although I've never been much for talking about um, venting my problems and whatnot, I did find it valuable, and I met some nice people. So, man up, shout out to Man Up to Cancer. Um, Also, a book I recommend reading is Cancer, the Emperor of All Maladies. It's an excellent history of the treatments developed for cancer from way back till current. And Ken Burns has a documentary based on the book as well. And it's an excellent story on the history of cancer treatments. Um, that kind of takes us up to kind of spring of 2025. Um, the Spring of 2025, I finished my 8 rounds of chemo, and I started into radiation. And after about a 4 week break on that. So on the next video, I'll bring up the radiation, and we'll start from there. And a few more videos will be caught up to current. I intend on trying to put these out about once a week, trying to keep them on a schedule, and I appreciate your viewing. Well, thanks a lot. Until next time, this is Rich, and this is my cancer journey.